Well, if you looked up this video, I'm so sorry, because you're probably quite sick, or at least a little bit miserable.
It's Dr. Victoria and George.
Today, we're going to be talking about some things that you can do at home to help work on that sore throat. And do you need to see the doctor? Well, maybe you do, but let's at least get started and see if we can't get you feeling a little bit better. For that sore throat, you can pick up some numbing cough drops. Think Cepacol lozenges. Mucinex has their own version, and that's going to help numb up the back of your throat and can be very soothing. Something else you can use is a Chloraseptic spray. I have mine here. And you can spray, gargle, and spit that out. And that will also help numb up the back of your throat, making you feel a little bit better, especially for those times when you're ready for a nap. Something else you can try is, it's a 50-50 solution. It's liquid Maalox and liquid Benadryl. So you combine those, and again, it's something you gargle with. Put it down and spit most of it out. If you want to swallow a little bit, you can. It will also be very soothing for the back of your throat. Now, often those sore throats, not always, but it does have some nasal instigators, or at least way to get started. So if you've got that post-nasal drip, I've got some information for you. Now, everything drains to your nose. Your sinuses above the eyes, below the eyes, between the eyes, they all go to the nose. The eyes go to the nose. The ears go to the nose. And there's these bundles of tissue there called turbinates. And they get big and swollen when you've got a cold, or say you've got allergies, and they block those drainage holes. And the best way to get those shrunk down is with a steroid nasal spray. Think Flonase, Nasacort, Rhinocort, any of those will do the trick. But most people don't use their nasal spray properly, and they just have poor technique. So you don't want to go straight up with your nasal spray. That will send the medicine up and down the back of your throat, doing you no good. If you go in, you're going to give yourself a nosebleed. What you want to do is go up the nostril and a little bit out towards the ear. Up and out. Now, I feel like the allergists are torn 50-50. You could do chin up a little bit, squirt, squirt, gentle sniff. Peanut butter cookies. Or you could look down at your toes. I like the cookie sniffing position myself. I feel like that's more comfortable. And again, in the nose, out towards the ear with a gentle sniff. Now, if I do a big snort, that's going to send the medicine up and down the back of my throat, again, doing me no good. However, these nasal sprays, they are great, especially for allergies. But in the short term, well, they're not so effective. They take about 7 days to really kick in. There's another nasal spray you can use called Afrin or oxymetalazone. This stuff works immediately. However, you should not use it more than 3 days. We are at a 3-day maximum. In those 3 days, you can use it multiple times a day, but you should not use it more than 3 days. Why? It constricts your blood vessels in your nose. So that means you don't have as much fluid able to leak out. So you don't have as much mucus and snot. But the body gets used to this, and it has a really hard time going back to normal if you use it for a prolonged amount of time. And people will never get off their Afrin nasal spray. And it is miserable to try and wean yourself off. So do yourself a favor and give yourself a 3-day maximum, not more than 3 days. But that's also something that can be very helpful. Another option is a saline nasal spray, or even a saline rinse. So there's little saline nasal sprays that can be very soothing and hydrating, and that in and of itself can help loosen some of the mucus in your nose and help that to come on out. You can also try a saline wash. Think a Neti pot or one of those Neil Med little squirty bottles. Comes up one nostril and out the other and get all that junk out. Very satisfying, a little unpleasant to use. Make sure that you are using the salt packets, otherwise it's gonna burn like a hoodang. And now, something else that you can do is to take some pain medicine scheduled throughout the day. I really like the NSAIDs, but this isn't a good fit for everyone. These are things like Advil, Ibuprofen, diclofenac sodium. So those are Aleve, Naproxen, all of those, that big family. You can also use Tylenol as an alternative. I like Aleve or Naproxen because it has a 12-hour duration that it's effective. There's also some extended release ibuprofens out there. But ibuprofen normally needs to be taken every 6 to 8 hours, so you have to take it more frequently. That 12-hour dosing is much easier, and it's really helpful to do, about 4 days or so where you're really scheduling that medicine, and then afterwards just taking it as needed, and that will help you get over your symptoms. Now, say you do want to go see your doctor. Not everything needs antibiotics. Let me just throw that on out there. And if your symptoms have only been going on for a couple of days, some of the times we're like, yes, we need to give you some antibiotics, okay. But if it's more of that common cold, you probably don't need antibiotics because it's viral. And viruses do not respond to antibiotic treatment. Now, if your symptoms have been going on 7 to 10 days, well, now I'm thinking, I probably should be getting you some antibiotics. But it's very common after a viral illness. So say you are sick, maybe you're even starting to feel better, day 5, day 7, but then you get sick again. You can get a superimposed bacterial infection. And that's also one of the contributing reasons why we want to hold off in terms of giving antibiotics. Just as a doctor, I want to be a good steward, and I don't want to be having antibiotic-resistant bacteria out there. I've got enough patients with enough allergies as it is to different antibiotics, so we don't need to make things more of a mess than they already are. Sometimes we need them, but not always. It can be helpful to see your doctor too, because there are some viruses that we do have treatment for. Most, it's just a supportive care. But if it's something like flu or COVID, we do have some specific treatments for those viruses that can be helpful. If it's age appropriate, you can always get the RSV vaccine. I do like the flu vaccine that we do annually. They've got a fresh new COVID vaccine that we'll do every year. So your doctor will ask you every year, would you like the new COVID vaccine? And folks are keen or not. Sometimes I think politics got a little bit too involved with that, but that's up to you if you want it or not. Right now, this is the 2023-2024 fall and winter season, and I've had a lot of patients with double whammies where they get strep and flu or strep and COVID. So folks are particularly miserable. Try these things at home, see what works for you, and if you're still feeling miserable, give your doctor a call. Thank you for joining us today, our healthcare team. We hope that you'll join us next time. Bye-bye.